However, again, that was why it's really important for us at Christie's Place to have that advocacy, branch of the organization, so that we're able to train and support women who are positive, so that they can be at those tables and advocating for those needs. And I'll tell you, I think it's been a huge success in San Diego. When I started in HIV back in 1998, Women, Children, and Family Services was at the bottom of a very long list of services that were available in Ryan White. We are now ranked as the 4th highest priority. So we have moved up. The budget when I first started was $200,000. We're now at $500,000. Now, by any means, is it enough money? No. Should we get more money? Absolutely. But I think that's a tremendous victory for the women in San Diego who are positive, and for our allies. We have lots of men who are positive, who are our allies. We have allies at the county health department. We have other allies that are fighting this fight with us to make sure that women's needs are met and addressed. So I think that there's been a huge shift in San Diego politically in terms of addressing, first identifying, acknowledging, and then addressing the needs of positive women. Because I think at first it was sort of a legislative requirement. There's this wiki piece in the Ryan White legislation that says the percentage of dollars that you get needs to match the percentage of dollars that you use to serve women and children needs to match the percentage of the epidemic. So in San Diego, it's like, let's say 11% of recent AIDS cases. So at least 11% of your Ryan White dollars, you have to prove that you're serving women. So the county created this Women, Children, and Family Services line item. But again, it was at the bottom of the list. And when you do a needs assessment of 1,000 people and only 100 are women, of course things like childcare and transportation are going to be at the bottom of that list. And so oftentimes women needs were neglected or not seen as a priority. And we've really fought to overcome that here. And so I think it's a real sort of testimony to the importance of social activism, and standing up and speaking out for what you need.
Well, and I mean, I'll just, with youth, I think it's a unique challenge because talking about sexual health in youth is pretty taboo. People, families, parents don't want their kids having sex. I mean, nobody says, oh, you're 16, go out and have sex. It's not what we want, but they do it. But nobody wants to talk about it. Nobody wants to provide that education. And we have a state like California where it's mandated that every student receive HIV education, but yet they don't have teachers that are trained how to do that. They don't have teachers that have no clue how to talk about HIV in the classroom. So it's this unique challenge, like, well, we have all the right legislation there that says you have to provide this, but who's going to teach it? And then you have schools that say, all right, in order to fulfill this obligation, we'll do a seminar. We'll have a guest speaker come for the day and the whole school will watch this lecture. Well, what about the kids that were out that day? They don't receive that. And well, the school, hey, we did our job, we got our stuff done. So they fulfilled that. And then you have schools that are blatantly saying, what, we're not going to we're not going to do that. We don't believe in that. We don't want to have it done, even though it's mandated. But there's nobody to come in and say, look, we're going to fine you, or we're going to, there's no regulation around it. Yeah. So it's a really strong challenge because youth aren't allowed to be sexual. In our society, they're not. It's not appropriate for a youth to have sex and enjoy sex. So it's really about don't do this and don't do that. And that's not an effective way to reach people. And all people, especially youth, they rebel even more when you tell them not to do something. So it's this kind of like, it's this fine line that you got to walk. You got to talk the right talk to the the conservative people, but then you got to talk in the language that the youth understand and relate to. So it's kind of like wearing these two different hats and trying to find that really fine line that allows you to get in both worlds. So
how do you talk to, because there are religious organizations that have HIV/AIDS awareness programs and outreach programs. They have them at the cathedral in Los Angeles, but there's still the stigma that's attached to this. But on the whole, there seems to be a disparate message occurring. So how do we bridge those messages with faith-based organizations? Can we do that?
I think it's really tough. I know I've been asked to come to a lot of churches to do speaking, and it's kind of weird. They'll ask me to come and do an STD or HIV presentation, but I'm not allowed to talk about condoms. Well, how do you really address the problem with HIV but not talk about condoms? And it's kind of just I play it as I gotta, what I believe is not necessarily the right way or the wrong way. If they want me to talk about abstinence, I've got to follow it because they let me in. They're saying, please come to us. This is important. So I got to take them where they're at and say, all right, maybe their values aren't in line with mine because I, promote condom use, promote, being sexually healthy. And I can't necessarily talk about that, but at least they're letting me in. At least I can talk about what HIV is and really making it a public health concern. This is not about sex or morals. This is a public health concern. It's no different than what, like you mentioned, H1, the flu. This is a public health concern, and we need to make sure the health of the people is protected. And if you go in with that light, it's a little bit easier for them to understand that and know that when they come into the clinic, when they come in to receive the service, that's where you can have those individual conversations and actually kind of get real about it. But at least we're reaching out there and we're getting just the tip of the iceberg there. You're touching the surface and saying we're here and we're able to, come in and let's talk to us. We can't do it in the church, but you can come into our clinic or come into our, wherever the services are, and then you can have those little bit, deeper conversations around it. I don't know what Liz's experience with dealing with that.
I think it's been extremely challenging. I think here in San Diego, we have had just sort of, in general, like a lack of support from the faith-based community. We have had several initiatives. I mean, just in I guess it's been 12 years I've been involved in HIV, things kind of wax and they wane. We did a lot of work with the faith-based community and, we kind of sustained stuff for a while and then it fell apart. And now there's another initiative to work with the faith-based community again. But I mean, in general, I think it gets back to those things we were talking about with the stigma.
Yeah.
I think about the behaviors, well, you talk about the homophobia that exists, the, marriage out of wedlock, depending upon what religious institution, you're going to. So I think particularly for our communities of color, we have not seen support, overwhelming support from many of the churches. I think that we're starting to see a little bit more now, but again, it's because there's such this involvement and outreach that we're doing locally with churches, but it's because we've been knocking down those doors for years and years and years and we won't go away. Not because they've opened the door necessarily for us and welcomed us in.
Okay.
So.
But is there any way that we could get your program and then just do a diagram of how all of those services branch out into different areas?
Mm-hmm.
So,
Definitely.
I mean, we talked about, there are headings. I mean, I've gone to both websites. There are headings of what you provide.
Yeah.
But what those things do and how they affect people is not always crystal clear. Not because your site isn't clear, but because, just because.
Yeah.
I would love to see how your program impacts society overall.
Mm-hmm.
So like Christie's Place, youth to youth, and then all of a sudden, at the very bottom of this diagram, after all of these services, how they point to one another and dissect and intersect and converge and come apart, then we have these whole people.
Yeah.
I would love to see something like that, so that when people look at this, they can say, oh, it's a picture. I see how this fits together, and I see how it affects me, potentially.
Yeah, absolutely.
Yeah, I mean, I think that's a great idea because that does happen, and people really don't see. It's not just, coming in to get tested or coming in to get, food or, a haircut or whatever the service is. It's about reaching out to those other things. I know, like, I'm part of a lot of different coalitions. I'll do, like, a human trafficking coalition that I'm on that it's not directly related to youth necessarily. It's not reproductive health, but it is. It has that piece to it. I'll do mental health ones. I'll be part of substance abuse coalitions that really, fight that. And because I really believe it takes everything. It's not just, we can't just live in this bubble. We've got to really reach out to every piece of the social services in our lives, because it's not just a simple thing as HIV. It's all these other things that are involved with it that, and I think it'd be really neat to kind of see how really where it gets out there and how it reaches all these individuals that don't just come in and want direct services about HIV.
Yeah, it's almost like putting the pieces of the puzzle together.
Right.
Yeah, absolutely.
Yeah.
Because we haven't even talked about mental health.
Exactly.
And not that someone is necessarily sick, but if you get a diagnosis,
Absolutely.
You can only imagine what's going on.
God,
What's
yeah.
going on there? I can't imagine. So, and we've talked about this
Yeah.
before. You know the stages that one goes through. We can go on and on, but I think we're gonna stop here.
Okay.
And I'm grateful to you. I am so grateful to you for
Thank
this time, for your time. Oh my goodness, Brian
Thank you
Hayes,
so much.
Thank you, sir. Youth to
You're welcome.
Youth, and Liz Brosnan, Christie's Place, here in beautiful San Diego, California. And we look forward to speaking with you again.
Thank you.
Thank you.
Thank you.